Dr. Rob here from drrobrehab.com. The purpose of exercise actually is to improve our overall health and fitness. Fitness is improved mobility, strength, endurance, and balance. As we age, we lose muscle mass called sarcopenia. So it means we start losing strength. Plus, the nature of how our tissues start to change and get old, we lose mobility. When you start losing mobility and strength, you lose endurance and balance. So when we exercise, our exercises should be predominantly focused on mobility and strength, and secondarily for endurance and balance. Let me show you right here. So when we exercise with an adequate challenge, that has to be an adequate challenge, enough to cause a change. Exercise is not exercise if it's not challenging to your body in some way. If it's not challenging to your body in some way, it is an exercise. So you have to challenge your body adequately. Now, when you have that challenge, your muscles sense it. The nervous system inside your muscles senses it, goes up to the brain. The brain comes on here and sends a signal to the muscles to adapt and change. And what are these adaptations and changes? One is the nervous system. The nervous system learns how to recruit more muscles. And the nervous system learns how to anticipate and expect these challenges, and it adapts the nervous system input to the muscles to improve the contraction. Our muscles also adapt. One, they learn how to contract better, more efficiently, more effectively. Plus, they use glucose and fats more effectively as well. Now, these changes occur due to a lot of complex neural hormonal changes that occur due to an adequate challenge from exercise and the post-exercise recovery. Furthermore, during exercise, we have increased blood flow, and that also is due to a change in our nervous system, and the consequence of that increased blood flow is a positive effect on our heart. Thus, when it improves our heart and our muscles are more effective and more efficient in their contraction and better utilization of glucose, and our nervous system can contract more, therefore our endurance improves. So we do not necessarily need aerobic exercise. What we really need to do is to challenge our muscles with strength training. That's the first and foremost thing we need to do after we improve our mobility. We need to have good joint mobility so that our muscles have the largest range of motion so that they can contract more. As our mobility and strength improves, then our endurance and balance will improve as well. And then any endurance exercise and balance exercise will be much more effective. So there are foundational movements that are essential for everyday life to improve your quality of life. They are efficient breathing, spinal extension, rolling over, reaching, crawling, squatting, and walking. These themselves right here can make up a great exercise routine. But to be a little bit more focused, to have a good idea of how to incorporate all the different thousands of different exercises that are out there, these are the fundamental exercise movements that you should be looking for. Squatting, lunges, hip hinges, pulling activities, pushing activities, and carrying activities. If you create for yourself an exercise routine that has these foundational movements as your ultimate goal to achieve, using these strategies, you can come up with a variety of exercises that will improve your fitness, that will improve your mobility, strength, endurance, and balance. Now remember, you need to increase the challenge. You need to enter your zone of discomfort. An exercise is not an exercise if it's easy to do. It doesn't have to hurt, but it has to be challenging. It has to push your body so that your central nervous system has enough of a stimulation to activate the muscles to make changes within the muscles. And through making the changes in the muscles, you improve your overall fitness. So what is an adequate challenge to your muscles? It all depends on the type of exercise you're doing. If you're doing body weight exercises, you're going to have to increase the intensity of that exercise by increasing the duration and frequency that you do, probably every day. By doing body weight exercises every day and doing them throughout the day most effectively, then we're going to get an adequate challenge to your muscles. Now, as you increase the intensity by maybe using resistance bands, you may use machine weights, or you may use free weights. Because you increase the intensity, then you can reduce the duration of the challenge. You don't have to spend as much time putting the challenge into those muscles. So that's where you do and go to the gym or use your weights for 30 to 60 minutes, maybe 2 times a week. Now, during those in-between times, you can be doing exercises that improve your mobility because you want to make sure you maintain that. And then you can be doing some endurance and balance exercises too. You can also be doing some body weight exercises in between the time period when you're doing those heavy resistance exercises as well. In order to improve your spinal health and fitness, we need to take advantage of this every single day. Now, you don't have to have maximal effort every single day. In fact, I don't want you to have maximal effort every single day, but you need to have some effort to induce enough changes so that you can improve your spinal health and fitness. Our fitness goals are mobility, strength, endurance, and balance. This adaptation can take 6 to 12 weeks, sometimes 6 months, with regular exercising. So you need to be patient. And without doing regular exercises, you have to be doing something every single day. Go maybe a half hour every day, at least. If you're not making those type of changes, we're not going to get the changes that you want in order to improve your mobility, strength, endurance, and balance, and improve your overall spinal health and fitness.